everyone, Karen Glasser here, and I am here with my co-host and son, Rob Glasser. Welcome to Minding Your Mental Health. How are you, Rob, today?
Not too bad. How about you?
I'm doing great. I love these shows because we talk about the topics that shape mental health today. We're teaching the importance of inclusion and we share why we should be kind because we should be kind, right? So, whether you're here live or on replay, let us know where you are tuning in from. And if you are here live and you have something to say to us, make sure you put it in the comments and we'll put it up on the screen. So, Rob, the topic today is, it sounds kind of basic, right? But it's not. We're going to deep dive a little bit. So, the topic today is, what is therapy? So, Rob, what is therapy?
Well, it's actually very simple. We don't have to get that.
Okay.
The objective for psychotherapy, according to the American Psychological Association, the APA, is basically the relationship between the individual and the professional, whether it's psychologist, a therapist, whatever you want to call it. Their job is to make you feel supportive, calm, and, willing to share in a environment that works for you and them. Now we'll
Right.
talk about how today you can do it from your phone, so you're really in a good environment because you're doing it from
Right. There's
wherever.
and people
Uh,
there's another but Rob, there's another thing when they talk about psychotherapy, they also call it talk therapy. That's actually another word that's used, the jargon. It's talk therapy. So all you're doing is you're talking, right?
and I'm going to flip it to you for a second, kind of put you on the spot for a minute, not too badly. So, because I was thinking about this before, there's the difference between when you familial talk and when you talk with somebody. And I have my answer to the question, but I was going to see what you thought. When do you think, or when do you decide that there's somebody better to talk to outside the family versus what you share inside? Now, I already know my answer. I was wondering if you had a quick one,
I
because that's really what it is. Because, like you said, you're talking. So, what's the difference between when you decide to do it just family to family?
Well, yeah. So
Or
psychotherapy is talk therapy, but there's also psychiatry, right? That is in addition to the talk therapy, they'll throw on the layer of the medication because they can prescribe. So to answer your question, when is the right time? I think it's different for every individual. I think that sometimes unloading yourself on a family member and telling them how you feel, they're not psychiatrists, they're not therapists, they're not, psychoanalysis, they don't do any of that stuff. They're there because they love you. So I think when you yourself get to that point where you realize all you're doing is talking about what's going on inside, that's the time I think that you need to go find somebody to talk to. And that, in fact, is what I did, when I decided after the fact that, what, it's talking to my friends is not helping. Talking to my family is not helping. I think I need to get some professional help. And that's what it is. It's professional help. So that's my answer. Rob, what do you think?
this one didn't take me very long to actually think, because when I do my sessions, my therapist actually likes to hear that I have, people like you, Krista, to talk to as well. So her viewpoint of it is, while it's good to have, and I like having my regular with her, because it's a nice outside point of view. I can throw back ideas. I can use her thoughts and processes, or not use them depending. But she likes the fact that I actually use who I have to speak to. So while she's the one in the professional seat, she actually does like when me and others, and she's told me others as well, of her patients will use the resources they have. So she always compliments me on, oh, it's great to hear that, you're talking to your mom, you're talking to your wife,
Right.
you're talking to whoever. So that's kind of what the question came up as, because
Yeah.
it was funny to hear somebody in that seat to say, good for you for doing that. And I think it kind of also blends into how it's changed as well beforehand. And I've talked to plenty of few before that I just thought were horribly clinical and just too whatever. And it felt very different 10 years ago than it did,
Right.
today. So I just thought, yeah, so that question just came to mind, because it is interesting to see how a lot of professionals today,
Yeah.
even though their job is to help, they like when you can actually open up to your family, your friends, your people that are there, because it's kind of the sign of growth. It's kind of the sign of the
Right. Sign of growth.
ability to to do. So that's just kind of where it was. But yeah,
I,
I mean, if you, I think I gave you the website.
I'm
The
gonna put
link
it
to
up. Hold
here
on.
has a bunch of different articles about what it is. At the top, where I pulled my little blurb from, is what the definition was. But they have some articles on it if you want to figure out which one's good for you, where you want to do whatever. But stuff like that, websites like that are good because it's the very basics. It's nothing too weird. It's not too complicated. It's just kind of like, oh, you want to find something? Type
Right.
in your city. Let's get you
I, I'm,
started.
I'm curious what our audience thinks. Again, whether you're here live or on replay. For those of you who are watching and you yourself are in therapy or you're thinking about going into therapy and you've been talking to family and friends, I'm curious, how is that working for you? Let us know. Put it in the comments. Just let us know. Yeah, I'm going to go to therapy or I'm in therapy. Curious to hear what's going on out there. So, how has it changed, Rob? Because it has. It's changed a
Yeah,
lot.
so you really had one choice, and I guess now you have two because the first choice is still around theoretically. Way back when, you had to do in person. You drove to the office, you drove to whatever, and you did it. Not really my cup of tea for various reasons, but really it was kind of a pain in the butt to have to, drive down there. Usually nobody was ever near you, so it was like a 45-minute drive from wherever you were because apparently nobody lived in your city. Who knew?
Yeah.
Not to say that any of them were bad. Not to say any of them were good, but it was kind of one of those, you had to go to do it. Now, today, known as telehealth or telecommunication health,
Telepsychology
whatever it's
tells
short
yes.
for, you can do it from any device almost.
Right.
You can do it on the computer, you can do it on your phone, I guess your iPad theoretically.
Right.
Um, and that one is great for many people for various reasons. Not necessarily if you don't like going somewhere, but just it's really easy to do. The one I have, it tells you, okay, your thing starts in 10 minutes. I'm like, okay, I'm going to go get my little phone stand, get myself, whatever. And yeah, that's the one that we use.
That's the one I used to. Yeah.
And you just go and do it. So it works in multiple ways as to it's easy to do. You're right there. You don't have to go anywhere. You can do it in your
Right.
pajamas, do it in your underwear, do whatever you want. You're good to go. To each their own, whatever.
That's way.
Um,
Yeah. That's too much.
but hey, I wear pants and a shirt, so that's
Thank God.
I have
Okay.
clothes. So that's the difference of where it's come from before. And yeah, you still do it today. A lot of times, if you don't
Right.
have the ability to do it on, or it's not in your plan or whatever, you can still go into your regular
Right.
scheduled person and do
Well,
that.
and Rob, the reason why I think it's so prevalent now, especially now, is because of the pandemic and people could not get out, and so
That's true too. Yeah.
up until then, there's something called HIPAA laws, which really was stopping the ability for doctors to do stuff like this because how did you protect the security and the safety of your patients or the privacy of your
Right,
patients?
because everyone's always worried about
Right,
Apple and stuff
exactly.
taking your yeah.
So we've come far. We have come far, and we now have the ability, obviously, to do therapy online. We put Better Health up, but there's a lot of other companies out there. Happier Living does it. All you have to do is
Talkspace. I think it's
yeah,
whatever his name is. Michael Phelps promotes that one.
right. All you
Um,
got to do is look, just Google on Google. Go do a Google search and
Google on
say
Google.
telepsychiatry or teletherapy or telehelp, and you will actually get all of these things. It's not for everyone. I know there are some people. I'm with you, Rob. I don't want to drive anywhere. I want the immediacy. I want to be able to sit down at my computer and let the therapist say, you can come into the room right now, literally. And it's like a Zoom kind of environment. I don't want to go, and I've done that before. I've gone other places and I sit there and then it's like, okay, I think I want to go home now. It's that kind of thing. So I agree with you
Like
on
you're
that.
sitting in the dentist office. You're like,
Like you're
I don't
sitting in
want
a
to be
dentist
here.
office, right, with other people that are sitting there with you, and you all
Right.
know
You're
why
like,
you're
this is
there.
awkward.
You all know
You're
why
like,
you're
I'm good. I'm out of here. I'll see you later. And the other thing too is that usually it's a simple, if it's billing, it's a simple billing system online. You get charged your monthly, your annual, and you're done. You don't have to worry about when's the thing due. I think on mine I just have it come right out. It just takes it out of my
there. Right.
account. Um, so there's many things here. Yeah, you're right. I mean, especially with the time of right now of not if you physically can't leave for whatever reason, but generally I think the ease of use, anything that's easy. Hello, Kathy. Anything that is easy is going to be more popular, I think. generally.
Okay.
Anything that is not easy or
Right,
uncomfortable is not going to be popular.
right,
Imagine that. No, but I mean, it's it's this topic is very simple. It's a very short, sweet, to the point, no frills. It's just a matter of how you use it, and I think that's our next point here.
right,
How do you use it? And this really, and I kind of went back and forth with you on it. This really is, I think you already started out. This is how you do it yourself. How does it work differently? Because I was looking, I was thinking about it of how, from the science point of view, it's all similarly done. It's somebody in a position who has somewhat of an ability to say, okay, what are your concerns? What are your things? What can I do to help? So
right,
really, all of it's similar how it is. It's really how you go forth. And for
right,
me, and I tell my therapist this, it's having the regular schedule. It's having the regular
right,
session with her. It's telling, it's thanking her for the tips and tricks.
right.
It's not so magic as people once thought it might have been. It's really, if you're not going to use it, don't use it. If you are going to use it, run
Right.
with it.
And
It's,
yeah, and there's something called cognitive behavioral therapy, CBT. So that is actually an offshoot of what we used to think of just general talk therapy. You would go and you would talk, and are you like Dusty? What are you doing over there?
no, a little
All
bug
right.
just fell on me. That's all right.
Okay. But cognitive behavioral therapy actually, that's the kind of therapy I like to do. Why? Because literally it gives you tasks. It tells you, well, why don't you try this? Traditional talk therapy will sit there and they listen to you and you talk, right? And you talk and you
Well,
talk
it's
and
funny you said the CBT because I do that too, but I use it differently than how you do it. I don't do it via the thing. It's more of the thought process and the creativity that your mind comes out. So while you use it your way, and that's I think it's my point. What I just said there is that
right.
you can
Exactly.
do the same thing. It's how you go about it. But I really would stress out, and I think you'd agree, since you're probably paying for this, only really do it if you're gonna do it.
Right.
Otherwise, you're kind
Right.
of wasting your time, their time,
Agree.
your money.
Agree.
It's
Yeah, and I think one of the reasons that we both like BetterHelp, both of us had been searching, and what BetterHelp allows you to do is you can, and again, we're not paid, we're not getting paid to shout out BetterHelp. We just both happen to use BetterHelp. One of the things that really struck me as being interesting is that you can pick a therapist,
yeah.
and if you don't like the therapist, no harm, no foul,
Pick
no
another
biggie.
one.
Pick another one, right? So they're making it easy for you to find the person that you resonate with, which
Yeah.
I really like. And again, I want to reiterate, we are truly not, yeah, as Kathy says, different things, different strokes for different folks.
Different
Different
strokes
things
for
for
different
different
folks.
Exactly. Pick the thing that works for you. And I think our purpose of doing this particular show today was to say there are lots of options out there. There are
Yeah.
totally lots of options out there, especially now with the telepsychiatry, telehealth, telemedicine, whatever you want to call it, specifically in the therapy arena. I think it's great. I think that's kind of that's it with our thoughts. I want to make sure people understand that they can also, as we always say, if you are right now being triggered or if you need some help, dial 988. If they're not going to do therapy with you, what they're going to do is they're going to send you to where you need to go via the phone. They will say, "Oh, you're in California." They will literally reroute you there. If you're in New Hampshire, they'll reroute you there. So don't call them thinking you're going to get therapy. You're not, but they will route you to where you need to be. If you're more looking for some information, check out NAMI.org. All sorts of information, as well as the National Institute of Mental Health, which is a governmental body. Check that out as well. Rob, we need to share our book. You and I put together a book. Let me get that off the screen. It's called Finding Your Passion. Let's get rid of this frame right now. Finding Your Passion. It's free. It's an ebook, and basically it gives you 5 steps on how to find your passion. Maybe get your head in the right space so that you can maybe do something that you actually love, and maybe even, I don't know, get paid for it. That would be nice. That would be great. Any thoughts? Any last thoughts we want to share with our audience out there about therapy?
Um, I'd say look at it from just a helpful perspective. like we say over and over, again, if it works, it works. If it doesn't, cool. Um, but okay, actually, I would say go in open minded to hear them out first. That's probably the biggest thing. You don't have to agree, and on BetterHelp, if you don't work with them, you can pick somebody else. That's fine. But at least give them 5 minutes to speak their piece as to what they think.
Right.
Not everything's right. Not everything makes sense. I mean, I will tell mine once in a while that, like I'll have to ask her to reiterate, or I'll be like, wait a minute, huh? I don't get it. It doesn't mean I don't like what she does, because obviously I've been with her for now over a year or two already. But, give them a few minutes of your time. They know what they're talking about. I don't mean to say air quotes, but they know, they're in the position, they should know what they're talking about. So I would say give them a few minutes. And then if you use something like BetterHelp and you don't click, pick somebody else. If you're not using BetterHelp, using something else, I'm sure
Right.
there's probably ways to work
Right.
there where you can pick somebody if you don't like who,
Right.
you get as well. So try it, see if it works, and let us know. I don't know.
Rob, BetterHelp is also offering group therapy now, which comes with your plan. So if you don't want to actually
Oh,
talk one-on-one
okay.
with the therapist, go hook up with a group. The point is, Rob just said, pick the thing that works for you and come to it with an open mind. Because when you do that, you're going to actually maybe get some help, which will be great, right? That is the purpose. We want to thank you for tuning in with us today. We know that you have a choice as to where you spend your time. We want to thank you for spending time with us. We are eternally grateful. We'll see you on Thursday, because we are doing a second part show on Altered Universe Live, and it's all about what, Rob? The business of
Animals.
And you might wonder, why does that have to do anything with mental health or what is therapy? Because, well, I think you're going to have to tune in, because there is a correlation. So please join us on Thursday. We will tell you why we're doing a business of animals as a second part for what is therapy. There really is a reason. Go out, give somebody an awesome day, and we will see you next time on the next Minding Your Mental Health. Goodbye, everyone.